our website traffic update. Just to let the group know, we are being recorded. If anyone has an issue, please feel free to let us know. We're also going to talk about the Atlas project timeline, an open enrollment update, and 2023 focus. Then we're going to move into the continuous quality improvement webinar section, and Shannon Biello will be demonstrating the new Atlas data portals. As you can see, the traffic has really grown exponentially over the last 6 months onto Atlas. Part of what we see in July is that we did do some very concerted campaigns around increasing awareness of the Atlas utilization. And one of the great things is we're still seeing the sessions increase even over a period of time. So we're very excited about that. One of the things that you'll notice, and Shannon will be talking through in the newly redesigned website, is we did notice that the completion of the addiction treatment needs assessment is relatively low. So when we went through the redesign process for the website, we've embedded it into the locator so that more people are actually getting to learn about what level of care is likely to benefit them the most. Because what we've been finding and what the research reveals as well is that most people think that residential is the only option to receive treatment. And the addiction treatment needs assessment is ASAM-based, endorsed by ASAM, and it really allows people to see not only what is the appropriate level of care, but also what are some of the additional services that may be really beneficial to individuals as well as they're moving in their recovery journey. Some of the project timeline for the next upcoming months. Right now, we are currently in open enrollment, which means that we are asking providers to complete the treatment facility surveys. During this period of time, we're very focused on those treatment facility surveys, and that will conclude on December 30th of 2022. The first few months of 2023, we're going to be going through data analysis and validation. That will be our data team going through and validating all the data that was submitted, reaching out if there's any questions that may be occurring on the data that was submitted or any misalignments. In March of next year, there will be the provider preview period prior to everything being displayed on the website. And then in April of 2023, we'll have the Atlas website launch and data refresh. So we're very excited. I think that each of you will be as well once you see how the new website looks and feels. It has a completely different look and feel as the current version. We've partnered with a national expert in building of websites and website design. So we have really had a excellent experience with them, and we believe that it will really significantly enhance the consumer's experience as well when using the website. As I mentioned, open enrollment will close on December 30th of this year. It has primarily been focused on facilities that did not submit earlier this year. All facilities can update data during this open enrollment period. And if you have not submitted the survey, please do so. The only state that is completely new during this open enrollment period is California, and they are completing all of the surveys for the first time. Whenever a facility needs to update their information, it really is a relatively quick process, generally 15 to 30 minutes. It is not as if you have to complete the totality of the survey like it was done on that initial first survey completion period. So strongly encourage all of the treatment facilities to please attest to the survey if necessary. And once you go through that full survey, each time after that, it's really the attestation. Some of the tips for open enrollment: assign one staff member as the Atlas champion. They really know the organization inside and out. They can gather the data from the treatment facility survey checklist so that everything is basically sitting there ready to go when the individual opens the survey and begins completing it. You do have the ability to close the survey and then begin it again right where you stopped. Oftentimes it is a clinical or program director. We've also found that compliance teams are often very good at completing the survey, or a quality management team. Generally, the time to complete is 30 minutes to 2.5 hours. I will say in general that 2.5 hours is for those very complex facilities that may have multiple levels of care and may have multiple sites. As those are more complex, they do take longer to do, but you know, that's really at the upper end of the time to complete the survey. Also suggest scheduling time with the appropriate leadership to secure their sign-off. There does need to be an attestation from an executive director, CEO, or other similar leadership member. And please review the data carefully before submitting. If there is any questions, please contact the atlasshatterproof.org during the data collection period. Thank you, Bill, for letting us know. Just want to also say that we are absolutely here for you. Please feel free to read our survey FAQs. You can submit a help desk ticket, contact us anytime, or our helpline. If you're wondering who is the director over your state, here is the various states that we are currently in, and here is who the director is for their state and the email contact information for them. We will be sending the slides out after this meeting so that you will have that email information. If there's any questions at all that you have, please feel free to reach out anytime. Some of the 2023 focus areas. The redesigned site is scheduled to go live in February. That's what Shannon will be talking through in a few minutes. There are 3 new states that will be starting the open enrollment with continued conversations in other states. Very happy to announce that by the conclusion of 2023, we will be in approximately 45% of the population of the United States, or that we will be 45% of the population of the United States will actually have access to Atlas and will be able to seek and look for SUD treatment in their areas. We are going to be beginning in 2023, specifically in first quarter, really focusing on patient experience surveys. This is really one of the differentiators of the Atlas website. We do display patient experience surveys once we have 20 surveys or more on the site. And we have found through our consumer testing that this is one of the areas that consumers really appreciate seeing. There is a human review of all of the surveys that come in. If there's any inappropriate language or something that does get flagged, we're also looking at IP addresses. So there is not only a human component to it, there is also a analytics and data analysis component to it as well, to make sure that they are reliable reviews of the facility. The questions are based upon CAHPS echo questions that are utilized in other healthcare fields, so they are reliable and valid measure and provide additional information for any of those consumers who may be looking for care. We have really found this as an area that's of great interest to providers, to consumers, oftentimes to states or other clients that we interface with. So we're really going to be partnering with many of those consumer groups within the states, peer recovery organizations, marginalized groups within the state, spiritual leaders, etc., to really encourage people to talk about how their treatment experience was, within the facility and to be able to provide that feedback. Any questions from anyone? And more will be coming on the patient experience surveys. We are developing several PowerPoints that will be being delivered to the treatment facilities and our provider organizations. There's also a QR code that will be sent out to the treatment facilities and provider organizations that you may use to garner some of those patient experience surveys. So we're very excited as we're transitioning into this next level with Atlas. Okay, at this point in time, if there is no questions, I'm going to turn it over to Shannon, who will walk us through the new website.
Sure. Sorry, everyone. And thanks, Zach. One sec while I share my screen. Lisa, can you stop sharing? Thank you. So, sorry, one moment. So as Lisa mentioned, we have a new redesigned site that we'll be launching at the beginning of February. We're really excited about it. And what we've endeavored to do is really simplify and respond to some of the feedback that we've gotten from providers and others in the field. About, sorry, one second. About challenges we've seen with the current site. And so this is the current version of Atlas. You'll see that, there's the option to take the assessment, as many of you might be familiar with. There's also options to do a location search. And once someone completes or inputs any of that information, they're taken to a search results page. But what we've really focused on in the redesign is how do we simplify this tool to serve all people who might be coming to Atlas. And again, in response to really wonderful and thoughtful feedback that we've received from the field. So what you'll see first is we've really worked to make the first action a single action. So when someone comes to Atlas, they can start right away by entering in their location information or facility name that they're interested in pursuing. And they'll be taken almost immediately to their search results options. What you'll notice too, and we're particularly proud about, is the fact that we've really focused on incorporating stories into Atlas now, and to hear from the voices of people who have done this before and have really focused on the way that community can be built within this tool, how we can use this, the stories and voices of people who have had this experience in the past to infuse some connectivity into this resource and really think about the tone of the site. When someone completes a search, you'll see we're doing an example in California. Again, they can either search by location or they can search by a specific facility in particular. If they search by facility name, you all might do that in looking for your facility. They're taken directly to that facility profile page that exists on Atlas currently. Otherwise, they're taken to a page with options. And this is how we've started to really incorporate the assessment more seamlessly into the Atlas website. So someone can go to their search results similar to what they would do on Atlas right now, or they're taken to the assessment through this Help Me Choose option. We worked really hard to simplify and streamline the assessment. We got a lot of feedback from the field in how the language and the functionality could be adapted in a way where it's significantly more accessible than the current version. So what you'll see are large buttons, simplified text. What we've added to are what we call empathetic statements, really again to facilitate that connectivity that we know is important from a website perspective. We want people to know that we're there from them. And people can go through the assessment similar to how they do on the current site, just in this more simplified and streamlined format. If someone starts to take the assessment and they want to see their search results, they're able to do so by clicking this link at the bottom. And the reason this is nice is because it shows exactly how the assessment is feeding in to the site so that the person is receiving tailored options. So you'll notice that we've already started to filter for things that someone's entered in through the assessment. And they've already started to show treatment facility results that are meeting those different requirements. A person can always go back to the assessment and continue to answer those questions. It's really that like seamless integration piece that we were talking about. That's something we really wanted to solve for. And these questions, if you're unfamiliar, are aligned with the ASAM criteria. They're meant to be an initial assessment that someone can take when they're doing a treatment search. We have messages that display throughout to make someone understand, again, that they're not alone in this process. They answer questions about any physical or mental health complications that might be important to know before they go to care. And then once they complete the assessment and they answer all the questions that are aligned with the ASAM criteria, including what barriers or contexts might impact their engagement in treatment, in selecting resources that might support them better in treatment, they can select any of these and they'll be connected with sites that specifically offer these services to patients. Then they get the same recommendation that they do in the current assessment. So you'll see they get that treatment type for level of care recommendation at the top, as well as the treatment services based upon their responses that are most likely to help them. And it's assessing that person's individual risk and severity to give them an initial level of guidance as they're doing a treatment search. We're very clear, and we want to make it known that this is not meant to eliminate or overtake a comprehensive assessment that would take place at your facility. It's really meant to create a version that can provide someone with an initial level of guidance, be it they're searching for themselves or a loved one, and hopefully guide them to a level of care that's most suited to their needs. We have several filters along the sides. You'll notice that all of the recommendations that someone receives from the assessment are again pre-populated as filters, but someone can adjust these as needed. And then there are additional filter options as well that a person can choose should they want to refine their search results further. We really tried to be as comprehensive as possible in what we were able to offer to people from a filter standpoint. For example, if a patient is on methadone, they'll be able to select that specific medication formulation for filtering to assist them again in finding treatment options that will meet their specific needs. You'll notice too that we're attempting to facilitate some of the comparisons that we currently do in our compare view in the search results. So it's showing where services like filtering options are met versus not in these facility cards, so that someone can know pretty much from the search results page if what they're filtering for is offered at the facility, and again making sure that they're getting very tailored results when they're searching for care in Atlas. And then finally, and very similarly to our current version of the site, we have these facility profiles. And this really emphasizes the importance of you providing your information to us so that we can populate this profile and display the wonderful services that you're offering to patients. And so we really worked to streamline this page as much as possible too. We want your contact information immediately at the top so patients can contact you if interested in care. You'll notice there's an option for patients to leave a review at the top. We'll show you how those reviews are displayed in your facility profile in just a minute. And then what we show at the top too is how this facility is meeting the different treatment services and preferences that a person entered into when they were searching for care to really tailor this site so that people know exactly how this facility might meet the needs that they've indicated either through the assessment or through filtering. We include information on payment too. This is why we ask you for which insurers you're contracted with, so we can at least give people an initial sense of which insurers their site accepts versus not. And people are able to search in this little box to get further specificity. And then we show in this little donut diagram how facilities are meeting those principles of care. This is exactly the same as it is on the current version of the site. You'll notice on the facility profile page currently, it's checks and X's. In here, we made it like a more streamlined, what we call donut diagram to summarize that information at the request of people who did user testing. We did an extensive amount of user testing before arriving at these designs. And then below it, you'll see that we include the patient reviews. In this view, is much more visual than the current version, and it's intended to show how facility, like what the aggregated feedback that facilities are receiving on patients by the domains that we capture through the patient experience survey. And as Lisa mentioned, these are based on validated CAPS echo questions. And we provide the narrative feedback on the right with the overall rating that the facility has received from the patient feedback. And again, we don't display this until we have 20 responses for a site. We also offer like a redirection. There are people that come to a facility profile directly and the site might not meet their needs. So you'll see us throughout, we give people the option to go back and take the assessment so that they might be able to enter information about themselves and get more tailored results and hopefully get to a facility that will better or best meet their needs. And then below we have here in this information section, not additional, but really treatment information on all of the wonderful services that your facility provides in that detail that you currently see on the facility profile so that people can dive into and look at all of the information that's available in your facility. And then a nice feature that we arrived at through user testing and want to make sure that you know is available to you is adding in images. And we did this at the request of people on our site who wanted to quote unquote see, you know, where they were going and feel comfortable with this. So as part of our data collection process, and if you completed the survey in 2021, no worries. You don't have to complete the 2022 survey. You're probably aware of that. But we'll be reaching out to providers to give them an option to submit their images so that we can include them in their profiles and really customize it even more. I'm going to pause and see if anyone has any questions before I jump into the password protection portals. Great. And so another thing I wanted to highlight for people who completed the 2021 survey for Atlas, I know there are a couple of you on this call that I've spoken with in the past. Thank you so much for joining, is what we call a password protected portal for facilities. And what that offers on the Atlas homepage is customized dynamic data visualizations of your data. And so if you are the account manager or primary contact for your facility, you should have received an email from us. If you haven't, please reach out to me and we can rectify that on our end to make sure that you have access. But what this ends up looking like is people have the option to go in and log in through this professional window. You enter your email and a password that you create. There's also a forget password functionality if useful for you all. And then you're taken to a profile page. I'm going to show an example, but I encourage you all to log in and see your own portals for yourself. But it really is intended to provide that very dynamic view of your data and show what we're able to glean from the information that's provided through the treatment facility survey and the patient experience survey. If you're a provider in one of our pilot states, you'll have access to both your 2020 data and your 2021 data, which is a neat feature for comparison. If you have multiple facilities, or if you only have one, you'll see there's a facility filter at the top. You go to that facility filter, you select a facility. Maybe you have one, maybe you have several, but they'll all be included in the same portal and you're able to view their data. And what you'll be able to do is control the comparisons that display on this page. So for example, if you want to compare the delivery of your services versus other outpatient facilities in your county, you would select that through the county filter and the treatment type filters, which show all the different treatment types, be it outpatient, residential, inpatient. And we also have a payment options filter as well. As a little sneak peek, if you haven't logged in yet, although again, I really encourage you to log in. I'll show you how dynamic the interface is. One moment. And I want to shout out Bill, who I spent a nice hour with, I think a week or two ago, walking through the portal. And so he can also provide his perspectives as well if interested on the portal. We had a really wonderful discussion.
That was a very helpful discussion.
Thank you, Bill. But through the homepage, you're able to go through and go through and scroll through all these different visualizations that are comparing your facility to whatever you filtered at the top. So this might be a comparison of your facility to others in your county, to Medicaid serving programs in your state, et cetera. You really control the comparison through your filters. What we also offer through the site, and we want to emphasize to you all, is that, we want to emphasize to you all is that resources for providers and our continuous quality improvement virtual learning series is very helpfully linked to you in this portal view, so that you're able to go in, and if you want to dive into these things a bit more, you can find the links usefully held on that first page of the portal. All of these things, again, are dynamic. They change as you change the data visualization, and they're meant to facilitate what you view as effective comparisons of your data against your peers. If you click the facility detail page at the top, what you'll be able to see is all of your data included in Atlas in a much, much more granular fashion. And again, compared to all other facilities, and you control the filters at the top. They're present at the top. You can filter again for your county. You can again filter for outpatient programs. You really control how you're comparing your facility service to service provision to others in your state. What we also have too is a button called facility information. This provides like the more descriptive information that your facility relays to us on the survey. We know that this information can change with greater frequency than your treatment services. So what we offer is there's a little pencil at the top. You'll see it right there on the top right corner. And what you're able to do is click that pencil and update any of these pieces of information. They get sent to us. Then we make the update on our site so that we're making sure that we're showing your correct address, we're showing your correct phone number, etc. We want to make sure that you're able to update this information in real time, given the chances that it can change, and making sure that we're sending patients to the right place. What we also have, and again, why we spend so much time encouraging the patient experience survey, is patient comments in this patient feedback view. We have the same thing. We have filters at the top, so you're able to compare your facility to others. This is a comparison of facilities in the state, one facility to facilities in the state. You can compare it again to facilities in your county, other outpatient programs, any comparison that you think is more apples to apples when you're thinking about the delivery of your services. And what you'll see is the state comparison. One moment. The state comparison is presented in this darker green, and your facilities data is presented in that lighter teal. And when you scroll over it, you're able to see the question that we ask patients in the breakdown of patient responses, so that you can again do some comparisons and benchmarking and see where your facility is exceeding certain percentages in the state, like the rating. This facility is a 9.2, where the average in the state is a 9, so it's a nice feeling. And then the narrative feedback that we collect from patients appears over here on the right. And what we want to flag for you is we juxtapose it by the date it's been submitted, the facility rating, like what they rated the facility on a 0 to 10 scale, and the narrative review that the patient provided. Now, not to give a very trite example, but you'll see that there's an option over here to flag. And the reason we put that there is because if we get patient feedback and you're saying there's no way it's correct, they're saying, for again, a very trite example, this facility doesn't serve Doritos and you do, you serve Doritos, you have the option to flag. It will take you to a specific page. It's not showing right now because this is an example, sorry. And it will take you to a form where you're able to log the reasons why the review is potentially malicious or fraudulent. It's submitted to us, and then we make a determination about whether the review needs to come down. This gives you the ability to flag those data that are not accurate as they display within your facility profile. We wanted to make sure that you had recourse to flag reviews that might not be reflecting accurate information. So that's the login screen. Again, if you're the account manager for your facility, you should have received an email from Atlas in November with this information. If you haven't, please email me directly and we'll be happy to set up your account. All of your facilities are included within one portal. And we really want to figure out how this information can be useful for providers. So a big old stay tuned on how we're going to continue to think about what potential improvements to this portal to really support you in using Atlas data in ways that are useful for you and your colleagues. Any questions? And again, I'll highlight too, clearly I had a nice one-on-one session with Bill to walk through the portals. If anyone's interested in that, I encourage you to email me and we'd be happy to walk through your portal, your data, in the ways in which this customized dashboard might be useful for you. And I love feedback. So I might ask you for feedback as well, just as a heads up.
Thank you so much for that, Shannon. And thank you for doing the presentation, even though I know that you are feeling quite ill today. So thank you very much. Is there any other questions from anyone on the call or any closing feedback or comments?
Just that it looks really good. Easy
Thank
to
you,
use.
Jennifer. I think everyone will be amazed when the new website is actually launched. It is amazing, and it is such a huge difference from what is currently available. We are all so excited to be able to share this with all of the constituents of the various states where Atlas is located and all of the state partners and provider partners. Okay, anything else from anyone? If not, have a wonderful remainder of the day. Have a wonderful December and happy holidays to everyone. Take care and look forward to connecting again soon.
Thank
You
you.
too.
Bye-bye.
Take care. Bye-bye.